So we're gonna make a ring or donut bandage. First we need a triangular bandage like this, and then you fold it into a 3-fold cracker like this, and then you take the end, you make a loop, and then you take this one and you tuck it in like this until it ends like this, and then you take this one and you tuck inside as well. Continue doing it until this whole thing is already tucked inside. So this is how the final bandage looks like a donut shape, and it's ready for use and it's done. Okay, so we're gonna show how to apply the ring bandage. Okay, so ring bandage is used to people with embedded or penetrating object. So it is used to apply pressure at the wounded area, eye person down, and elevate injury. So you carefully, gently put the ring bandage at the wounded area. So this is the penetrated object on my skin, like this. You carefully put it, and then you take a cloth. And you start wrapping around the ring bandage so it doesn't move and affect the area. Go, and then you wrap it around, put it in, and it's done. You see, so it doesn't. So as you can see now, so that is the penetrated object. So it helps to secure the penetrated object. So it's done. So after that, immediately seek for medical advice. Before the procedure started, I've already explained to the patient about the procedure. Then use a triangle bandage, open it up, place it in lengthwise against the person's body. Make sure the point of the bandage is toward the person's elbow on the injured side. Arrange the person's arm so that it is held in front of their body and bent and below, with the forearm slightly up above the horizontal, just like I did it. Then tie the hanging end of the bandage to the top, and by looping in behind the person's neck, make the knot on their injured side. If they are not wearing a collared t-shirt, make sure to put a handkerchief or any cloth on their neck. The injured arm should be comfortably supported in the sling. Fold the point on the bandage along the person's arm and pin or tape it with any micropore or paper tape securely. Like what I've did, I've stuck it inside. And then check for circulation or capillary refill. So finally, this is how the arm sling looks like. For the splinting, first you have to explain the procedure to the patient. As I've explained to the patient beforehand, I started the procedure. Okay, those are the equipment that we need, which is 3 bandage and any object to support the arm of the patient. Expose and examine and assess for any bleeding in the patient's, and then apply splint to the affected area with the correct principle of splinting. First, what you have to do is apply the object, put the object below the arm of the patient, and then tie with the bandage. After securely tied the first bandage, then take another bandage and apply and tie it on the other part of the patient's arm. Make sure to tie it properly on the patient's arm. Then take the third bandage, tie a knot at the end of the bandage, just like shown in the video, and then put it around put it under the patient's arm, just like how I did. Then take the other part of the bandage, put it on top of the neck, and make sure to secure the neck because the patient is not wearing a collar t-shirt. And then take the another end of the bandage and tie a knot. Firmly secure the bandage. After that, check for any distal pulse or motor and sensory function.